All right, so our Wellness Wednesday continues, and this time is with Dr. Faith Adewale. He's a Nigerian medical doctor, AR pioneer, visual artist, and Big Brother Naija Season 10 breakout star. He's joining us with the brilliance and creativity that made him a national voice for youth, innovation, and social impact. And he's going to be breaking down something really interesting. RSV, the tiny troublemaker that bullies babies. It's really important to understand why it's dangerous for babies under age 1. It's great to have you here, Dr. Faith.
It's great to have you too. Thank you for having me.
All right, so people are seeing you in a different light this morning.
Yes.
They're used to seeing the entertainment side of Faith Adewale, but this is you for our wellness segment. I just wanted to, give you a chance to say hi to your guys online, because there are quite a lot of them.
Hello, Faithfuls. I hope you enjoy the show. I have so much in store to teach you.
Yeah.
And I'm excited to see how this conversation goes.
Okay, so RSV, for those that haven't heard about it, what exactly is it?
Simply put, think about it like you're having a party.
Okay.
And then there's someone that crashes your party uninvited. Okay. But they don't just crash your party, they also leave a mess everywhere. That's what RSV is. Now, if you're talking about it from a more clinical term,
sure,
it's from the Paramyxidae family, and it's called the Respiratory Syncytial Virus. It affects mostly children under the age of 2,
sure, and
then adults over the age of 45.
And interesting.
And the reason for that is if you notice, the immunity varies around that period.
So older than 45 and younger than 2 years old.
Yeah, so they're older than 45 when they are immunocompromised or they have issues. But let's go back to children.
All right, so the average family sees a child coughing or sneezing. They just call it cough and catarrh, right? So you're saying it could be more than just catarrh?
Definitely.
All right, so why is that? How do we know the difference?
Good. So catarrh is actually a symptom of an underlying problem.
Okay.
Cough is also a symptom of an underlying problem.
Okay.
RSV is a cause which can lead to the catarrh that we're talking about.
Okay.
Now, we have this virus that has invaded your system, and what it does is it causes irritation. Now, imagine you had a tube here. You have a tube here.
Okay.
And then...
Like a tube, like a pipe or a straw?
Like a pipe or a straw, so to say. Yes, a straw. And then now, if the pipe is clear, if the straw is clear, and you want to draw fluid out, everything goes properly. So that's how your lungs work. Air can go through it. Yeah. But imagine you now stuff that pipe or the straw with tiny, tiny wool or cotton wool, and then you try to suck out of it. Yeah. It's going to be hard. Of course. Because it's blocked. That's exactly what RSV does to you. Okay. It blocks it goes into the bronchioles. It causes something called bronchiolitis. Okay. It irritates the bronchioles. That irritation causes mucus to be produced. Okay. The mucus being produced causes inflammation. And then this inflammation is what now gives the rest of the symptoms. You see the cough and the catarrh. Okay, so now we talked about babies under 1, and I wanted to stick there. But for parents with young children right now at home, what are the things they would probably notice to see that it's not just merely cough and catarrh? Sure. So first off, you notice the change in how your baby is. Okay. The way they move to you. Okay. Now, one of the things you see is the breathing pattern. Now, we have something called wheezing and rhonchi. Wheezing. Wheezing is that sound. If you hear a child's breath, yes. Okay, do the sound again. Yes. That is wheezing. So that's wheezing. Yes. So you don't need a stethoscope or to listen to the child's back to hear this sound sometimes. Yes. Sometimes you can just hear it. Labored breathing. Labored breathing. Yes. Okay. Any other symptoms? So we have that. We have nasal flaring. Now, you look at your baby's nose and you see that this tip will be doing the baby's nose is flaring. Okay. That because they're trying so hard to breathe. And that's a problem. We also have something called an abnormal visualization of breathing. Okay. Now you look at your baby's stomach, and the baby's, it's like it's trying to explode. Okay. Because it's so hard to breathe because it's blocked. And now your baby's doing everything they can do to get air in there. Okay, so now a lot of parents have had children that went through it and came out of it and they didn't have any issues. But you're saying that this is high risk and that they should see professionals on it, right? Yes. Okay. Now, from this particular point where you notice all these symptoms, how long should a parent wait before visiting a hospital? So when you see symptoms go this far, let's say you're day 1, now your child is having labored breathing, the child is distressed, it's only right that we take them to the hospital or you take them to your nearest health practitioner.
Okay.
And another thing to note is RSV doesn't have a drug to cure it.
Okay.
It is self-suppurative. But the reason why you're going to the hospital is you have to hydrate the baby.
Okay.
You might have to give them oxygen therapy.
Okay.
You might have to, there's something called a bulb where you suction.
Yeah, they suction out the mucus. I think I've experienced that before with one of my girls. Now, when you hear oxygen, parents start to think, wait, doctor is saying oxygen. They probably start calling family members like, oh my God, oxygen. What exactly is the oxygen doing, and is it really that serious?
It is serious, but it's also not a death sentence. It's not a death sentence.
Okay.
All we're doing is, it's called suppurative oxygen delivery.
Okay.
Now what we're doing is, your baby is having this struggle to breathe.
Sure.
You need oxygen for respiration.
Sure.
And the reason why, you don't want to scare the parent and say, oh, your baby is going to die. It's a simple thing that we can fix just by delivering oxygen. Okay. The mucus is blocking the delivery of oxygen. Okay. And your baby is struggling to breathe. The oxygen therapy is simply to help respiration happen. Okay. So we don't want to alarm the parents. We don't want to make things,
All right. So now let's talk about the issue of home remedies. Hey, the home remedies are a thing. I know my mom used, vapor rub on my children's chest and back throughout, and it seemed to help. Yeah. It seemed to help. Warm water also is said to help.
It helps to decongest the chest.
All right, so you're saying that eventually this virus just wears itself out and goes, but then you treat the symptoms.
The fever, the suppurative therapy, you do all those things by the side.
But now, what about the parents that just feel, you know what, I'm just going to go to the pharmacy and find, some remedy from the pharmacist. Okay. What do you say to parents that do that?
Okay, first off, you applaud them because they're trying to help the child. Okay. You care for your child enough, you should. You care for the child enough to go and seek help. But seeking help correctly is more important than seeking help. Okay. Now, when you approach the pharmacist, you don't want to go there and say, give me this, give me this, give me this. Okay. You're not, you're not the professional at this. What you want to do is, okay, hey, you bring the child. These are the symptoms we're seeing. Yes. And now the trained pharmacist can now tell you, oh, this is what I have. Due to the socioeconomic issue with Nigeria and the way things are, the primary health situation can be sometimes you go see a pharmacist first. Yeah. But then once things start to go beyond the pharmacist level, they direct you to the hospital. Sure. So the reason why we go to the pharmacist is because that's how it is in Nigeria. Yeah. And they try to help. And once things are getting out of hand, they lead you to the correct health center. But
the real thing we're supposed to do is after what? The adverts used to always say, after 3 days, visit your doctor. Is it really after 3 days?
Maybe after 2 to 3 days. If you don't see any improvement. After 2 to 3 days, if you don't see any improvement, visit your healthcare practitioner.
All right then. So now, RSV. I've heard of influenza. I've heard of the flu, the common cold, and they all seem to be sort of related in my mind. I don't know. I'm not the professional, but I'm wondering about what causes all these things to thrive. What sort of environments are children and families being found in that causes the RSV to thrive?
That's a brilliant question because they're all in the same family. They're viruses. Yeah. And the thing about viruses is they try to adapt everywhere. Okay. They want to survive. Now, think about contact. Think about air-to-air transfer. Okay. So how do you prevent this? Have a clean environment. Okay. When someone has a cough or catarrh, instead of coughing or sneezing into your arm, you can actually try coughing into your elbow. Sure. Or you can get, disposable napkins, you use and you throw it, you dispose it off. Yeah. But another thing is washing your hands. Okay. You would not believe how important it is to keep proper hand hygiene. You're touching tables, you're touching chairs, and babies, for example, they're the ones that are most typical to this because your baby is crawling everywhere. Sure. Your baby is touching everything. And in as much as you love the baby, you also have to let them move around. Sure. So wash your baby's hands, wash your hands. Everything your baby comes in contact with, make sure it's clean and hygienic. Keep a safe space. When someone has this, any catarrh, cough, keep them away from other people. Sure. And it doesn't mean you ostracizes them. Yeah. You just want them to get better so they don't transmit it.
Because it does kind of feel like, some people have recurrent cough and catarrh, they have recurrent issues with respiratory infections. Yeah. And I think I learned a few years ago that if anyone in the house has a cold, you're supposed to go around and put hand sanitizer on all the door handles.
Yeah.
So I can't remember where I read that. The person said, go around all your door handles, spray hand sanitizer on all your door handles, and nobody else will have a cold in the house. I was like, yeah, well. And then I did actually do it, and it actually worked. So I really do connect with you on the hand washing thing. I know that hand washing became a really major thing during COVID, but it does feel like people have sort of just relaxed.
Relaxed now.
They've relaxed.
Better, yes.
And I heard from a few doctors, that said, you know what, they had less of other infections during that time because people were washing their hands, right?
Yeah.
So let's go over the symptoms one more time for RSV that you should take note of.
So you have coughing.
Yeah.
You have wheezing. You could also have fever.
Fever?
Yes. And then rhinitis.
Okay, the flaring of the nose.
Flaring of the nose.
The chest.
Yes, the chest.
Okay, all right.
And when you want to diagnose it, most times we diagnose it based on, we see the symptoms.
Sure.
So you could do a test too to get that.
All right. Now, Dr. Faith, thank you so much for coming to talk to us today.
It was a pleasure.
We're going to have you throughout the month of December, yes?
Yes, we will.
All right. Fantastic. And we'll take another interesting topic again next week. Now, if you have comments, contributions, you can always put it right there in the comment section, and we'll hand over those questions to Dr. Faith. Hopefully next week we'll be able to answer them. That's for Instagram, WakeUp Nigeria TVCE, and of course use our hashtag WakeUp Nigeria on TVC if you're on X. All right, then we're taking Dr. Faith to the kitchen today. Okay. Yes, we are. Fun. The ladies are in the kitchen with our chef standing by. All right, let's take a stroll.
Okay.
All right, let's go.
Is that good?